Hello viewers, welcome to my channel. I am Dr. Monish Naidu and today I am going to be sharing an interesting case of retreatment orthodontics with you all. Come, let's have a look. And this is where the magic occurs, where beautiful smiles are created, the culmination of advanced dentistry and incorporation of the latest technology in dentistry. Now coming to our case. As already mentioned in the title, this is a case of retreatment orthodontics. Retreatment means the patient has already undergone a complete treatment of braces prior to visiting our dental office, where some changes have happened in the dentition which the patient is not satisfied with. So in this case, the patient has reported with a chief complaint of excessive upper incisor display, and spaces that have present in the upper jaw which have opened up. Now as we can see here that the posterior dentition, the upper right side is well intercuspated, and so also on the left side, but there is an asymmetric occlusion. In the upper arch there are spaces that have opened up which were extraction spaces distal to the upper left and the upper right canines, while in the lower arch mild amount of irregularity is noticeable. The patient's smile, as the patient had complained, there is an excessive incisor display but with a pleasing soft tissue profile, though with some amount of maxillary prominence. So our primary objective in this case is that we need to intrude the upper incisors for correction of the deep bite, and we need to close the residual spaces. But the challenge is that the patient does not have a large amount of overjet and we need to close those spaces. So that is the challenge in this case which we have overcome, which I will be presenting in the video ahead. The patient opted for fixed braces, and the first thing that was done was to use a coil spring on the upper right side to open up spaces distal to the upper lateral incisor to push the upper dental midline to the left side to coincide with the facial midline, while upon the right side a micro implant was placed to pull the dentition onto the left side. So thereby there was a push and pull mechanics that was used to improve the midline of the upper arch. After the initial alignment and leveling was achieved, now was the time to plan for the intrusion in the anterior region as well as the retraction of the dentition, for which two micro implants were placed between the central and the lateral incisors of the upper arch bilaterally. An additional implant was also placed on the right side between the 6 and the 7 in the upper arch for symmetric retraction of the upper dentition bilaterally. And then on 1925 stainless steel, intrusion arch mechanics was applied by taking support of the anterior micro implants, and retraction was done by taking support of the posterior implants. Additionally, GIC bite blocks were placed so to counteract the extrusive effects in the posterior region of the arch via, since anterior intrusion was attempted, thereby causing a net more anterior intrusive effect. But to our surprise, the amount of intrusion did not, as expected, was not achieved. Now why did that happen? That happened because we put an almost equal amount of force in the anterior region as well as the posterior region, and the 1925 arch via did not yield to the amount of force that was applied. So as we can see here that we did not achieve much intrusion in spite of using 4 implants. So where did we go wrong? The answer lies in the physics. Now here the amount of, since the span from the anterior to the posterior region of the E-chain was longer, it has generated a higher amount of force of retraction as compared to the anterior components of intrusion, and thereby the retractory force overpowered the intrusive force, resulting in no net intrusion. Hence, as it's very popularly said, when the going gets tough, the tough gets going. So we had to think of a plan B. So what would that plan B be? In this case, a 1725 TMA arch wire was designed in the form of a continuous T-loop. Now in this continuous T-loop also had a modification in which the mesial leg of the T-loop was shorter by about 3.5 to 4 mm as compared to the distal leg. So what would this do is that when it is placed as a continuous arch form, there would be an intrusive force because of this height differential in the anterior region and an extrusive force in the posterior region. To aid in further intrusion, this arch wire was additionally given an intrusive force through the microimplant which was attached anteriorly, and also to reduce now the net retraction force, which we had kept it quite high using the microimplants posteriorly. We could do it in a more controlled manner with a slight tug on the distal leg of the T-loop bilaterally. Hence we had better control, so a lesser retractive power but more intrusive power anteriorly. Normally loop mechanics and implants is never done together, but like we had to do some modifications in this case, and so we did it and see how well it worked. We got a good amount of intrusion anteriorly. As we can see that there is a step now between the canine and the laterals. The lower incisor brackets are now visible, and the retractory forces, by, as you can see that there is a pull in the distal leg, the T-loop has widened, giving that retractive effect. So now our net force, a net vector of force, was more intrusion and less retraction. But bear in mind, retraction was there, which has resulted in a significant closure of the gaps. So this process was continued for the next 3 months, and surely and slowly we were able to achieve a net intrusion as well as retraction involving the closure of spaces, and now to allow some amount of settling of the posterior dentition, the posterior bite blocks were removed and we continued with the anterior bite blocks. A well aligned lower arch form in 1725 stainless steel, and then the upper arch was leveled with initial nickel titanium and then with 018 Wilcock wire. Now the arch form does not have a cant, it is well occluded. The anterior bite blocks have been removed, and this is the post-treatment result. A good amount of deep bite correction. Now it's almost a normal overbite, a normal overjet. The teeth do not look over retracted. There's a good amount of torque now in the anterior region. The posterior dentition is well settled on the right side, and so also on the left side. closure of all the spaces in the maxillary arch, and a well aligned and retained lower arch. The patient smiles. Now the incisor display has definitely reduced. The patient is very satisfied with her result. Good parallelism of all the dentition that we have achieved. Patient has been informed about the third molar extractions in the lower arch which are due. So that brings to the end of our case. Hope you enjoyed this video as much as I enjoyed presenting it to you. Thank you.